You've done a lipid panel and markers just aren't where they want to be, and the doctor wants to put you on a statin. But did you know there's other things you should look at that increase cardiovascular risk? First, if you're a smoker and you have hypertension, those must be addressed. But in addition, did you know your lipid panel could be increased by things like low thyroid? If you don't have optimal thyroid function, this can cause abnormal lipid levels. You must also look at your micronutrients like vitamins and minerals. If your vitamin D is low, if your iron is high, if you don't metabolize and break down your B vitamins, all of these can actually make your lipid panel be abnormal. Do you have a poor diet? Are you not eating properly? You're eating a lot of grains, a lot of high glycemic carbs. Are you not consuming the right amount of omega-3s? All of those can directly affect a lipid panel in a bad way. If you think diet could be an issue, look at blood markers like a hemoglobin A1C. Look for a fasting insulin and a fasting blood glucose. Those can tell you you do have an issue of metabolic syndrome, and that's leading to your abnormal lipid panel. Could an underlying infection be driving abnormal lipid panel? You could have gingival issues. You could have gut dysbiosis. You could have Lyme's disease and not even know it. You might want to look at doing a HSCRP, which is a marker of inflammation, and sometimes that can indicate where your problem is. Environmental issues. You could be toxic, full of heavy metals, or pesticides. And finally, there's genetics. Unfortunately, the deck could be just stacked against you, and thus you must look at all of these things to make sure, even though your genetics have set you up for bad cholesterol, believe it or not, it's your lifestyle that can prevent that genetic pattern to be a problem for you. As you can tell, there are many things that can cause an abnormal cholesterol panel, and you must look into these other things to evaluate before we make proper therapy choices.